Hi friends, hope you guys doing good. So in this video we shall be discussing the recall part of the surgery from your INI-CET May 2023. I have labeled this as the past, present and future. The past because the exam is done. So we are just trying to understand what the questions had come and what would be the answers, the present, so that we need to know what we have to do in the present scenario, and the future because what we can expect in the upcoming INI exams. So let's begin our discussion with the first question that we have, which is not a perennial approach for rectal prolapse. So the trends for INI is that they have a special focus on GIT, and keeping up with that trend, even this INI May exam had a lot of questions on the GIT track. So this was a very straightforward question that was asked with respect to your rectal prolapse, which is a very commonly repeated topic. Right. So over here, not a perennial approach, the answer would have been your Ripstein's procedure. The rest are your perennial approaches, and Ripstein procedure is your abdominal approach. So while we have studied for rectal prolapse, this is a commonly taught topic in each and every class everywhere. That is, there are two sorts of operation, which is your perennial approach and your abdominal approach. So as per the feedback from the students, not many had difficulty in solving this question. The only catch over here is those who answered in hurry and missed reading the note. Right. Apart from that, it was a very straightforward questions, and we do not have much discussion with respect to this question. The detailed explanation of rectal prolapse we have discussed many a times, and we will not have it in this video. Now the next question that we have is, identify the pathology shown in the following MRCP section. So guys, last INI had focused a lot on your gallbladder carcinoma. So even our teachings of all the PYQ was focused on the gallbladder carcinoma, but now what they have done is they have actually shown you an image of MRCP and asking you the pathology. They have asked you previously regarding your CBD stones. So if you look over here, this part, this is nothing but showing you a colodicolithasis. So they had asked you previously about your primary stone, secondary stone, recurrent stone. Now they are asking you regarding your MRCP, diagnostic findings, and they have also previously asked you regarding your ERCP. So the point over here is, our focus on the previous year questions should actually shift from previous year topics. The topics have been repeated, and we need to understand at the same point that we need to go for a detailed study. It's just not the superficial study for an exam like your INI. Right? If you look at the next question over here, identify the anatomical anomaly seen on the USG scan for the evaluation of gallbladder. Now, as per the information gathered from the students, it was a figure of your Phrygian cap. So it is given in your Bayesian love and your anatomical anomalies of your gallbladder, right? So this was a straightforward question where they correlated the anatomy with radiology. So guys who had seen the image and could correlate with the anatomical abnormality of the Phrygian cap were able to solve. So again, the topic gallbladder, you did not get a question from gallbladder carcinoma. That does not mean that they have taken a new topic. They have actually focused on the same topic but the variety. So just a superficial study or just studying the previous question of gallbladder carcinoma would have not sufficed over here. We need to go in the detailed study and in-depth study of few topics which are your examiner's favorite for your INI. Now moving down to the next question. 73-year-old presents with painless bleeding. Which of the following is best for evaluation? Now some people have told me which of the following is not used for. So we do not know the exact questions as per your recall, so do let know in your comment section. But if this question is to be considered, then definitely over here the answer would have been your colonoscopy and CCT. Not much to rule out over here. Over here is the CCT, but the colonoscopy and the CCT would be a better option, right? Now these are your tumor marker CA99 and CA, which is also used in case of your colon cancers, but CA99 is more specific for your pancreatic carcinoma, right? So what was the question? Do let know in the comment section. But on the preliminary, some people have told which of the following is best and which of the following is not used for. Now if the question was not used for, then over here the best answer would have actually been a CA99, because it is much more predominant in your pancreatic cancer, right? So again, this question they have asked multiple times which of the following is a tumor marker for your colon cancer, what is your mode of management for your colon cancer. So if you see, the questions might not be repeated, but the topics are being repeated. Now even in case of rectal prolapse, if you guys remember, specifically if you have given your last INI exams or if you have come across the MCQ, the last time they had asked you regarding your rectal cancer operation, regarding your nerve injuries and all. So this time they asked regarding your rectal prolapse. So just not that you just read the rectal carcinoma part. No guys, you need to read some topics in detail and depth and revise them well, which is going to fetch you your dream rank in your INI. Now next question was with respect to your bowel as wall of hernia. So many people are saying there were various images of the hernia given. Now what exactly the question was, we do not know, but majority of the students have told us that it was the bowel was forming the wall of the hernial sac. So in that case the answer would have been sliding hernia. Now you can actually check over here, Middle's hernia is basically your two loops of the intestine if you look over here, and then this is your sliding hernia, which is forming the bowel is itself forming the wall, and then this is your reduction in muscle. Now which was the image given to you? You guys need to check it yourself, because we didn't give the exam. As per the data received from most of you, this was somewhat the image given. Now those who are seeing it is a reduction in muscle, so please go with it, but the basic idea is this. Now many students told that this is again a tough topic. It might be a tough question if you have not read it, but then again, hernia as such specific is a very important topic. They have been previously focused on your triangle of doom, they have previously focused on triangle of pain, right? Then they have also focused on your femoral hernia, and this time they have asked you this image based question. So again, emphasizing the point, it's just not that we solve the PYQs of doom and pain or femoral hernia or just learning the boundaries. It's important to read in detail about hernia, because we have a lot of questions hiding in it, and to the best of my knowledge this is also a important topic given in your Bailey and Love. So most of the questions are being framed from your Bailey and Love, so it is mandatory that you guys read Bailey and Love. Just superficial study is not going to give you that edge for your INI exams, right? So moving down to the next question. So we had this, a patient complains for dysentery. The first clinical clue to your question, 6 to 8 weeks, upper abdominal pain, and the CT image was given, which is showing a hypodense homogeneous lesion, right? So the clinical clues were a straightforward hinting towards your amoebic liver abscess, right? So there are no confusion regarding this, a straightforward question from your liver abscess topic. Now again, this is not a new question, this has been previously asked in various forms, and also previously they have asked your highlighted question. Liver abscess, they have asked regarding about your pyogenic liver abscess. So again, the important is just not the previous year topic, but again a previous year question, but rather the previous year topic which we need to study in detail. So there are no shortcuts to your success. Now the next question that we have is, so image based match of the following locations of appendix. Now this is an image taken from your Bailey and Love again straight, right? So which was the position of, some say it to be post-ileal, some say it to be retrocecal. So if you look over here, this is your diagram. Now which was asked to you, you need to say that. So the most common is your retrocecal. Now as per the data received, most of them have said that it was asked to identify the retrocecal appendix, right? So again a straightforward question. Now you see, if this question was not asked previously, but they have focused an image from your Bailey and Love, and even those who say that this image was not exactly the same image, they might have taken from some other source, but the point is the positions are going to remain the same. The description, the image in Bailey and Love was sufficient for you to answer that. Now another question. Now we move down to this next segment from the vascular part, right? Now the previous trend was that they have always asked question from your varicose vein, specifically your CAP classification. The candidates had messaged me like, we are going to read CAP and go, because they are going to get a short question, because it was a trend in AIIMS that they have asked around this last 2 to 3 paper. Now what they did this time is a beautiful question that was framed, which is the following: is not the test for Fmge insufficiency. Now is this a tough question? My dear friends, AIIMS has another tendency and knack of asking questions that are very clinically oriented. Now no one of us would have passed MBBS without seeing a case of varicose vein, and this were the tests that are usually performed in your clinical examination of varicose vein. Now do you need to know all the tests? The answer is no. I do not remember what is Fmge test, what is Morris's test, what is Stredenberg test and Perthes test. How do we need to know? But there is something which we need to remember. In case of varicose vein testing, we used to do one test in order to rule out deep venous thrombosis, right? Rule out DVT. Which test was that? That was, my dear friends, modified Perthes test. So even if you didn't know the test, you could have actually answered it. So the clinical examination part which you have learned in your MBBS is going to come handy while you solve your INI paper. And guys, those doing internship, you must have definitely seen this modified Perthes test being done, if not by your consultants, at least by your juniors for their MBBS exam. Because nowadays we normally do duplex and the role of this test are barely minimal, but then in order for your clinical practice, there are some old school examiners who still want you all to perform this test, and there is the need for knowing this test. Now the next question was intermittent claudication, which is not C. Now again a classical question that you come across, or scenario that you come across in your clinicals. So when you study about your arterial disease, now those guys who have read Bailey and Love, they would have marked this question just on reading it, not C. Bailey and Love clearly mentions one line: pain starts on taking first step. No, it is unlike osteoarthritis. So this is your osteoarthritis, right? So it is an osteoarthritis that the pain starts developing on taking the first step. Now when you are knowing about intermittent claudication, please remember another point of claudication: distance. So if there is a distance, that means patient has to walk for some time, so that claudication distance happen. But over here it's mentioned pain starts on taking the first step. So without even having a much knowledge and the basic clinical knowledge which you had done in your final year MBBS, you would have been able to solve this question. So the answer over here is pain on taking the first step. So if you look over here, this vascular part, it was basically your clinics oriented questions which you must have read in your 9th semester. Almost all colleges over India, pan India, do teach this varicose vein and arterial diseases. Now moving down to the next question. Okay, so all except are true regarding your breast conservation surgery. Again, a favorite topic for your INI examiners. They have a habit of framing a lot of questions from breast, be it breast carcinoma or benign breast diseases. So if you look over here, breast conservation surgery has been repeatedly asked. Now there has been various forms of asking it. What they have done is they have actually conglomerated all the forms and framed this question. Wide local excision, is it a true statement or false statement? True statement. Post-operative radiation is not compulsory. Now there is something called BCT, which is BCS plus radiotherapy. Normally all patients of BCS would require your post-operative radiation. So I would say this to be false. Intraoperative frozen section is required. Yes, many centers perform intraoperative frozen section in order to see that if whether they have achieved their desired margin. And axillary lymph node dissection is done, which is again a true section. So answer goes to be B. So now we have moved down to the endocrine section, which is asked in your AIIMS. So the first question from endocrine was a straightforward question which we keep seeing in our clinical practice because there has been a paradigm shift from your MRM to your breast conservation surgery. So it's not that this question was a bouncer or something new. We do expect such questions coming in our exam, and this was also a previous year question and even a previous year topic. Now USG breast versus mammography, which is not true or advantage. Now if you look at this question, can differentiate between solid and cystic lesion, true. Helps in guided biopsy, true. Not helpful in young female with dense breast. Now it is a false statement. Can visualize your deep lesions, which is again a true statement. Now you need to remember that USG is helpful for localizing your dense lesions in localizing lesions in the dense breast and in the young female. So this is the advantage of the USG, right? So now if the question was framed in some other way, that would change our answer. So it was, again, even if you didn't have the maximum knowledge about USG and mammography, this question could have actually been solved with using our common sense. So we have two questions from breast section which were actually very straightforward questions that was asked. Now, so this question is basically a pharmacology based question. Treatment for transfusmap resistant carcinoma breast, which is lepatinib. This would be again discussed in your pharmacology chapter. So now if you see over here, we all know about trastuzumab. Now since we all know about trastuzumab, the one who would have known a little more than trastuzumab was the winner over here. So again, the topic is the same. The questions, this was your PYQ, this was your PYT. So it is your PYT which is important, and it's just not that superficial study that you do and you win. You need to now have a detailed depth analysis of few specific topics in order to give you the edge in your INI exam. Now the next question is the most common cause of your adrenal incidentaloma. So if you see, the answer is your non-functioning adenoma. Absolutely a one-liner question. Now it could be a pheochromocytoma, carcinoma, Dissonance disease, or a you say a Cushing syndrome. There could be so many causes adrenal adenoma, but the most common cause is a non-functioning adenoma. Now this is absolutely a one-liner question which does not require a lot of discussions. Now moving down to the general part, which is not a complication of TPN. Now again, if you do not know much, TPN is total parenteral nutrition that is given by your intravenous routes. Now it can cause pneumothorax while doing your procedure, right? Now there are peripheral line TPNs and central line TPNs. So if you are doing your central line, you can cause pneumothorax, it can cause refeeding syndrome, which is one of the most common complications of your TPN, which is characterized by your hypophosphatemia and hypomagnesemia. Then it can also cause osteoporosis. Now aspiration, that is going to happen when we have your enteral feeds, right? Because TPN is given by your IV routes, it's not going to cause your aspiration. So this aspiration is going to cause by your enteral routes. So guys, if you see again, not a lot was expected in this question, just the basic apply of your common sense and the clinical practice that we do, because in your internship, in your wards, we are going to deal with TPNs, which is rarely going to cause your aspiration, and it's almost always the enteral nutrition which is going to cause your aspiration. Now another question that was from the trauma, that is your severe RTA with fracture shaft femur who was initially stable, presents to ER after 12 hours with sudden onset of rash over axilla and chest with unstable vitals. What is your most probable diagnosis? So some have given us only 2 options, and this is what I could gather from your internet sources. The other 2 options are yet not known, but then this is a classical presentation of your fat embolism syndrome, right? Hypotension and sudden onset of rash with a RT and a fracture shaft of femur. So all these are your clinical clues which we classically describe in your fat embolism syndrome. This you must have come across in your pathology lectures and in your orthopedics lecture. So this is a very commonly asked topic with your direct clinical clues to the question. So all that was needed was to identify them and not make a silly mistake. Now so we have another question which was identify the pathology shown in the image. So people say retention cyst and granular, plunging granular and dermoid cyst. So let's look what exactly a ranula is like. So this is what most of the students told us, a swelling somewhere over here. So this is exactly what a ranula looks like. This is an image from your Bayesian nerve. Now many told us it was a mucus retention cyst. So was this the image? If so, then this was your mucus retention cyst, right? So this were your 2 most common confusions which were in your this image, but then these 2 both images are directly from your Bayesian nerve. So if this image was given, it was a mucus retention cyst, and if it was this image, it was your ranula. Right, so let's go with ranula, as majority have told us the first image which I shown you, which was for your ranula. Right, now again many people found it to be a tough question. No, my dear friend, they have asked you previously regarding your management of ranula, what is the type of ranula and all, and this time they just asked you a spot diagnosis. So again, the previous year questions, no, we just cannot rely on the previous year questions, and the emphasis has been laid now straightforward that you need to revise the topics and you need to be a little much more updated in order to have that edge, right? So I think this is perhaps your last question that I have for you. So all except are false for thymoma. It occurs in posterior mediastinum. Answer is no, it is in your anterior mediastinum. It is your most common neoplasm of thymus. Yes, it is true. It can be seen on X-ray. So if this was your question, yes, it can be seen on X-ray, but at the same time you need to remember it can be missed on X-ray as well, right? And then it can cause dysphagia, dyspnea, pressure retention. It is also true. Now why I have marked B as a better answer? Because that is a definitely true statement, and the better answer over here would have been the most common neoplasm of thymus, and it is also a direct one-liner taken from your Bayesian nerve. So with this few questions, now this was the past and the present that we know. Now what about the future? Now if you look at the trend, right, we all have been shouting aloud PYQ, right? We need to ace the PYQ. There is no doubt. Yes, we need to ace the PYQ. But at the same time, the future is we need to ace the PYT, which is your previous year topics. Now, what do I mean by that? For example, gallbladder carcinoma. The last year, the focus was on your gallbladder carcinoma. So this year, even I taught a lot about gallbladder carcinoma, and what they did was they took 2 images and asked from gallbladder. So the point is, gallbladder is important. The focus was all about gallbladder carcinoma. No, gallbladder is important. Now, if you look at breast carcinoma, there are plenty of questions being asked from your breast carcinoma. So we need to know about breast carcinoma in details, right? Then if you look the clinical aspects, the clinical tests and the clinical scenarios, specifically what you see during your internship, or you perform them as a, I would not say final year, or as a MBBS students. And then the next focus has been on your images. There have been direct images asked from your Bailey and Love, and also specifically one-liners, for which I think at your level the best would be Bailey and Love. So in order to achieve this, what we guys should be doing it now, we need to devise a plan so that those who are not cracking the INI exam this time definitely crack it for the next time. So for this images and one-liners, we need to stick to the Bailey and Love, and we need to keep revising your clinical test and internship. So what we are going to do is, now in your YouTube channel, in my YouTube channel and in the GamePG YouTube channel, we are going to share a lot of one-liners and images from your Bailey and Love, and also your various clinical tests and scenarios, so that it becomes an interactive learning for you, where I'll be trying to share it in form of short videos or in form of shorts, so that it would just take 5 to 10 seconds of your daily day in order to revise that, right? So I hope you guys do well in your exams, upcoming exams, and those who have not done well, please don't get disheartened. This is just an exam. The life still awaits for you the best. So this INI might not be yours, but definitely the next INI will be yours. So all we need to do is back ourselves, get back to studies, focus, and study with the same motivation in order to achieve our target. Thank you.